In the studio this morning, I have Dr. Matthew Yamwache. He is a consultant, a urologist at the Kolebu Teaching Hospital, and he'll be answering our questions this morning. Good morning, Doctor. How are you?
Doing very fine, my God.
First off, obviously, we know testicles are typical to the male species.
That's right.
But within us, as men, who would be the ones that would experience testicular pain?
I would say that in terms of, as you said, it's peculiar to men, so every man is a potential.
Right.
But in terms of who experience pain, depends on the age. You can get it from the first day of birth to very old age. But of course, the causes then varies based on the age of the particular individual. So it can occur in each group, and our approach or how serious it is sometimes depends on the group you are dealing with.
Okay. For instance, then, I mean, since there's such a broad spectrum, would anybody or any young man before puberty experience testicular pain?
Yes, a young man before puberty is likely to experience testicular pain, and in that situations, then it is a medical emergency.
Right.
Good. It's an emergency because one of the commonest causes of testicular pain has to do with infections, and most of them are related to sexually transmitted infections.
Right.
But before puberty, we assume the patient or the client
would
not be sexually active.
Right.
Okay. So then infection goes away. Then at that age, the most common cause has to do with what we call torsion of the testis.
Okay.
The testis is hanging like two balls, like a mango on a stalk.
Mm-hmm.
It can twist on itself.
Right.
Now the blood that comes to the testis flow through the stalk. So when it gets twisted on itself, it prevents a blockage.
Right.
And that can lead to severe pain in the testis, which when you don't do anything about it, can lead to you losing the testis altogether.
Right.
So testicular torsion is one of the most common things you experience in children within that age bracket, below puberty.
So let's move it a bit on. Anybody after puberty, what could cause testicular pain?
Good. So after puberty, probably let's take it maybe 14 through to about 20.
Mm-hmm.
It is still an important issue to consider the testicular torsion. Because there are a few of them who are sexually active. Mm-hmm. So then what you call epidermolysis or inflammations or infections of the testis then comes in.
Okay.
But again, testicular torsion is high on the list because most of our surveys shows that most of our men below 20 years are not sexually active, and the majority.
Right.
So testicular torsion is an important thing to consider. It's also important to consider the fact that sometimes you get a pain in the testis, but it's due to what we call a hernia.
Right.
Protrusion of the intestines into the scrotum.
Yeah.
And that can be the cause of the pain. So yeah, there's a pain in the testis, but actually it's due to the intestines that have come there.
Okay.
So we also look at complications of hernia, like obstruction.
At what age can one get a hernia?
Normally, again, it depends on the age. It can occur from birth onwards.
Okay, right.
But of course, one of the commonest causes of the hernia is people who are doing a lot of activities, athletics, lifting heavy objects and things. So at that age, that can be an issue.
All right.
Then from the 20s to probably the 50s, it has to do with the infections.
Okay.
So sexual transmitted infections, the pneumocolitis, that becomes an issue. However, that age group also has, the risk of developing what they call cancers of the testis. So at that age, even though the infections are of concern to us, but of grave concern are cancers of the testis.
Okay.
And we want to look at those ones also.
All right. Are there any indicators or signs that this pain may be coming? Is there any way that we could possibly foresee some kind of testicular pain?
I think that, like any symptom, pain is a reminder of itself. I mean, you are unlikely to be able to sit with pain. And the testicles and the penile area are very sensitive. A lot of nerves, so pain there is easily, felt, easily experienced. So pain is very important. It's also important to appreciate that for the infections, it tends to also not only pain in the testis or scrotum, but also pain when you are passing urine.
Okay.
Or you may be passing urine more frequently than usual.
Right.
So the two tends to go together. So that is what we say.
Okay.
For the cancers, sometimes the pain is quite a dull ache, and people may ignore it, for a while. So no matter how dull it is, no matter how discomfort it is, it's important at least you feel around, you look around to see what is happening. So it can be very severe pain, or it can be very dull ache or
either which way, you should always double check.
You should always have to double check.
Can testicular pain lead to infertility?
It can. See, pain in the testis tells you that there's something going wrong with the testis itself. And as your preamble showed, the testis is the main factor for producing the sperms, which will then lead to fertility. So if there's any damage to any component of the testis, then it will manifest as pain, and so it can lead to fertility. Generally, like the infections, the pneumocolitis, like the trauma, maybe a hit to either place, these are all issues that can lead to damage to the testes, damage to sperm, and then you get infertility.
Okay.
However, the most common cause of infertility in the male has to do with what we call varicoses. These are the veins that gets from the testis to the body getting dilated.
Okay.
They end up leading to high amount of heat concentration and chemicals within the testis area, and this then lead to a situation whereby the testis gets destroyed, and so the sperms may come out, but you see that there are other very few what we call oligospermia, or most of them are virtually dead or killed
right.
off. So
is that why men are advised not to take hot baths?
Exactly. So if there are any evidence that there are problems with fertility, they will advise against hot baths, and also advise against multiple underpanties, where the blood intestines that have come there.
Okay.
So we also look at complications of hernia, like obstruction.
At what age can one get a hernia?
Normally, again, it depends on the age. It can occur from birth onwards.
Okay, right.
But of course, one of the commonest causes of the hernia is people who are doing a lot of activities, athletics, lifting heavy objects and things. So at that age, that can be an issue.
All right.
But from the 20s to probably the 50s, it has to do with the infections.
Okay.
So sexual transmitted infections, the pneumocolitis, that becomes an issue. However, that age group also has the risk of developing what they call cancers of the testis. So at that age, even though the infections are of concern to us, but of grave concern are cancers of the testis.
Okay.
And we want to look at those ones also.
All right. Are there any indicators or signs that this pain may be coming? Is there any way that we could possibly foresee some kind of testicular pain?
I think that, like any symptom, pain is a reminder of itself. You are unlikely to be able to sit with pain. And the testicles and the penile area are very sensitive. A lot of nerves, so pain there is easily, felt, easily experienced. So pain is very important. It's also important to appreciate that for the infections, it tends to also not only pain in the testis or scrotum, but also pain when you are passing urine.
Okay.
Or you may be passing urine more frequently than usual.
Right.
So the two tends to go together. So that is what we say.
Okay.
For the cancers, sometimes the pain is quite a dull ache, and people may ignore it, for a while. So no matter how dull it is, no matter how discomfort it is, it's important at least you feel around, you look around to see what is happening. So it can be very severe pain, or it can be very dull ache or
either
mild
which
pain.
way, you should always double check.
You should always have to double check.
Can testicular pain lead to infertility?
It can. See, pain in the testis tells you that there's something going wrong with the testis itself. And as your preamble showed, the testis is the main factor for producing the sperms, which will then lead to fertility. So if there's any damage to any component of the testis, then it will manifest as pain, and so it can lead to fertility. Generally, like the infections, the pneumocolitis, like the trauma, maybe a hit to either place, these are all issues that can lead to damage to the testes, damage to sperm, and then you get infertility. However, the most common cause of infertility in the male has to do with what we call varicoses. These are the veins that gets from the testis to the body getting dilated.
Okay.
They end up leading to high amount of heat concentration and chemicals within the testis area, and this then lead to a situation whereby the testis gets destroyed, and so the sperms may come out, but you see that there are other very few what we call oligospermia, or most of them are virtually dead or killed off. So
is that why men are advised not to take hot baths?
Exactly. So if there are any evidence that there are problems with fertility, they will advise against hot baths, and we also advise against multiple underpanties, where the body sharp pain that you can feel. But there are also some nerves that transmit some mild pains. A kind of pain that to give you some abdominal cramps, a kind of pain that can give you nausea, and a kind of pain that actually can cause you to throw out. We call this autonomic nerves. So when it hits you, these two pains come into play.
both of them.
The sharp pain that will give you the pain you want to, scream, you want to, cry or yell, and then the kind of pain that makes you feel nauseated, you want to vomit, you want to throw out. So these are the two components that come into play, and we take all into consideration, and they are all equally important. Trying to make up a diagnosis what may be going on.
Now, besides physical, contact with the testicles, is there any way of preventing testicular pain?
Yeah, I think protecting it is important. We have talked about that for the case of the trauma. For the case of infections, if you could prevent yourself getting an infection in the system, whether gonorrhea infection or any sexually transmitted infection, then that can be a way you can prevent testicular pain, because the tubes connect. So if there's any infection within the urethra, the tract, they can seep their way into the testis and cause pain there. So once you use the condoms, use barrier methods, then you can prevent that. The torsion is an important. Unfortunately, you can't prevent that. But should you get any pain, they want you to get your doctor to be examined to make that it is not a torsion. Because the testis twists itself on itself, you have only 4 hours to salvage it. If you lose it within 4 hours, if you don't, it goes gangrenous and dark, and then you have to lose. So these are the issues that you can do to prevent it. Of course, if there are hernias, you want them to get tackled before they drop into the scrotum and then give you the pain. But for prevention, by and large, is protecting it and also trying to get early treatment of preventing infections that may get it affected.
As men, we have a predisposition not to actually consult doctors about everything, especially when it comes to our private parts. Now, is there any particular link with testicular pain and testicular cancer?
There is a link, an important link. Initially, the swellings or the cancer in the testis is not painful. But with time, it becomes painful. Unlike the acute pain you get from, let's say, hits by a football or something, this kind of pain is dull ache.
It's more of an ache.
So dull ache, not too painful. Then that's how the cancers typically present. Of course, associated with a mass, and that is an important thing. So that's what.
But not all testicular pain relates to testicular cancer.
No. And generally, even when there's no pain and there's a swelling, we get worried. The chances that the cancer is rather high. But of course, the cancer can get pain. Once you start getting the pain, it means that the cancer may have been there for quite a bit of time, and the earlier we deal with it, the better.
So right now, I mean, let's we look at fashion at the moment. There's a lot of tight clothing, jeans, trousers. Everything seems to be fitted at the moment. Is that in any way affecting or could cause testicular pain? Keeping things tight around that area.
It is two-pronged. For the pain that is due to something like the varicose, where they are the enlarged vessels, the pain that are due to the blue balls and things, the tight structures will help, because they will then decongest the area and then make every fluid and every swelling go out. So actually, for people who complain to us with that complaints, we actually advise them to wear a boxer shorts or panties sometimes smaller than they would normally would have worn, just to keep it up there. For the hernias, it can also be helpful to keep the place pain-free. However, if you have got an infection, if you have got the cancer, then when you wear the tight panties, then they are very, very painful. Because even when you touch it yourself, you want to jump up. So if you put the tight panties, then they are not helpful. So depending on which category of cause of the pain, it can either be helpful or not helpful. And normally your doctors will advise you.
When it comes to cancer, we always say self-screening. Check yourself every so often. How do we go about checking the testicles for lumps or growths?
If you take the scrotum, you've got a testis, which is the round ball in there, and like a typical bell, it is hanging on a kind of a rope, and the rope has also got structures in there. So you can get the cancer in the testis itself or in the rope that hangs on the testis. So you have to examine yourself first. You feel the ball smooth, nice, not painful, and then you feel your way around the cord until you can get to the neck of the scrotum. Then that is it. That's how we examine. So you have to feel it, and it's important that you feel it, every morning, feel that they are fine, both of them, and feel the cord. Normally, swellings in the cord are not that dangerous in terms of cancer. It's uncommon to have cancers on the cord. So once you see that the swelling in the cord, you say, probably not to get worried. Probably just a swelling from maybe the sperm that are collected there, and they can easily be dealt with. But if you feel a lump in the testis, or hardness in areas of the testis when you examine it, or pain, then we can say that please consult your doctor. Let's have a look at it. But you can feel it smooth and nice, so far as the balls are concerned, and they're getting a bit hard and lumpy. There's a cancer.
What would be treatment for testicular pain?
For testicular pain,
it would depend on what the cause is. But I mean, the average, let's just say it's not cancerous, it's not an infection. Let's just say that the person just has an ache in his testicles. What would you advise as treatment?
So first, we want to talk to you, we want to make sure that it is not anything sinister. Sometimes we ask you to do the urine test for us because, as we said, infections within the tract can be a cause. So when you do a urine test, or what we call a culture, or take the sperms for culture, you can identify a part of infection, and that can tell us that there is a bacteria, and it can even tell us which antibiotics could be useful. Then we can give that treatment. Sometimes we can ask you to do what we call a scan, an ultrasound of the scrotum, and that can also give us an idea of what is happening. If these things are normal, or if by talking to you think these things are not indicated, they want to know how bad the pain is. By and large, most patients, once you show them that it is not a cancer, it is not a torsion, it's not an infection, they say, the pain is not about that, so I can deal with it. So we say that, then we just observe you. If the pain gets unbearable, get to us, or pick up, off the counter a paracetamol or something, and you're fine. So if it is bearable, no problem. If it's unbearable and it's none of these conditions, you can take any painkiller of your choice while they work. No problem at all. However, if it has to do with some of these grave conditions like the testicular torsion, then we want to come in quickly, and most of the time it has to do with surgery. Surgery to try and untreat the testis.
And you said you have a 4-hour window for that.
A 4-hour window for that. Otherwise, you eventually lose it. So or try to remove the testis at all for confirmation that it's a cancer. So once you suspect a cancer, then we want to make a surgical incision to take out the testis for them to look at it under the microscope. So invariably, you may end up looking one testis if you suspect it is a cancer.
Can someone still reproduce with only one testicle?
Excellent, you can. I would say that anything that's important, God gives us two. So there are two of them. One can do the job perfectly.
So just because you lose one doesn't mean you're inefficient in any way.
Not at all.
You can still fire.
You can still fire, not at all.
Wonderful. Doc, I want to thank you so much for coming in this morning and educating us a lot about testicular cancer. I also want to thank Voltic Natural Mineral Water and Lipton Tea for sponsoring this particular segment.